Generally, when we have cared for the client throughout her pregnancy, we have on her record what her methods of desired pain control are. So a mom that says, I would like an epidural, we are ready to help her get that. But sometimes when you get to labor, if you're just in the early phases, you might not be able to be at the hospital yet. You never know the stages of labor. It can take a long time in the beginning or it can go quickly. But we like to make sure you're in active labor before you get an epidural. So we help them learn comfort techniques to get to that point. Because if you can be relaxed, you can work with your body and progress more quickly into active labor when we would say, yes, this is a great time to get an epidural, or if they don't want one, then they just keep laboring. Things that we help them with are, of course, everyone knows the breathing, but then there's different positions to help the baby get aligned well. Hydrotherapy is great, where if they want to get in the shower, or we have a tub, you cannot deliver in the tub, but you can labor in the tub, and different massage techniques that we teach their support person, or the midwife or nurse also helps with that. We can have essential oils to help them feel more relaxed. We just kind of do whatever they want us to do to help them feel as comfortable as possible. It is hard work having a baby, but if you can get to a level of comfort where you can work with your labor, then you have a much better experience. There is no specific centimeter that you must be to get an epidural. We just like to make sure you're in actual labor before we do it, because of course, with an epidural, you can't get out of bed, you don't get up to the bathroom, so we just want to make sure that your body is laboring before we give it to you. That being said, sometimes you arrive at the hospital and it's obvious you are in labor, we will get you that epidural, but it's not an immediate process. When you are admitted, we have to do blood work to check your levels, give you IV fluids. That whole process can take 45 minutes or so. So it's good to have relaxation techniques to use while you are waiting for the epidural, so that you're giving good oxygenation to the baby, you're staying open and relaxed, so you're not fighting the process of labor. When a client decides she wants an epidural, we call the anesthesia department. They come up and administer the epidural. During the process, which takes about 15 minutes, 30 minutes, just depending on mom's anatomy and how many contractions she's having. If we have to kind of pause in between contractions, it can take half an hour. We give IV fluids to make sure her blood pressure remains stable. We monitor the baby throughout the procedure. Mom has to be in a sitting position on the bed, and her support person can help her be in the optimal position, help her remain still. And then the anesthesiologist talks her through the process and lets her know what to expect. I think the most uncomfortable part is having to sit in a position during a contraction. So that's when we say, okay, let's work on your breathing, just focus on breathing to help through that. The anesthesiologist gives a numbing medication, which is a sting and a burn. I think that's the most uncomfortable part. And then you just feel pressure with the administration. There's not a needle that remains in your back. It's just a very tiny little catheter that gives continuous medications. The nice thing about the epidural is it does not affect the baby in causing the baby to be sleepy so that they have breathing problems when they are born. The mom is completely alert, baby is completely alert. There's even a button, so if you're feeling a little extra pain, that you can self-administer medication through the epidural, but it has a lockout so that there's no concern for overdosing. When a mom is laboring without an epidural, she has the benefit of being able to change positions. So during the process of labor, I feel where the baby is, find out where the baby's lying, and then help mom get in positions to help the baby align well and engage in the pelvis. We have different tools. We have yoga balls, peanut balls to help mom's position in bed or out of bed. Depending on where the baby is, the mom has pain in different areas. If the baby is posterior, what we call sunny side up, she will have a lot of back pain with her contractions. So we provide counter pressure on the back to help with that discomfort. And then a lot of times moms tell us, oh no, that doesn't feel good. Yes, that feels great. And then as you progress through labor, some things that felt good before don't feel good anymore. And that's how we kind of know mom is getting into transition. And that's when it's great for the partner to have done childbirth prep classes with the moms, because they will see the different types of techniques to help in different stages of labor. We have an awesome offering here at Fauquier. We have online classes that are interactive with a live person, offers 6 hours of education. It's a great opportunity. It has prenatal boot camp, comfort measures in labor, breastfeeding tips, baby care, and it's awesome because no matter what your crazy life schedule is, you don't have to come to the hospital to take these classes. We have online offerings, and when you come to the office, we give you a handout that shows you how to register and then the payment code, so that is no expense to you. And then of course, we build on what you learn in the classes. The nurses, the lactation consultant in the hospital also help you with the baby care and the breastfeeding. And then during your pregnancy, your provider kind of emphasizes and highlights questions that you might have from your classes.